Hi everyone, welcome back. So this is really intended as another one of my pregnancy related videos. I'm going to be talking about how massage can help with diastasis recti, which is otherwise known as abdominal diastasis or abdominal separation. Now, for the purpose of this video, I am talking about it in relation to pregnancy, and certainly all the clients that I have seen with it, who come in with lower back pain, it's all been pregnancy related. However, this is actually an issue that can also affect both men and women in the gym who kind of overdo the abdominal exercises, and that's where if you see pictures of people like with a six-pack and you'll see like a gap, that is actually where the muscles have separated. So it's not actually, while a lot of people will look at it and think, oh wow, what a six-pack, actually it's not really very healthy and can actually cause problems. So even you gym goers out there need to be aware, and certainly the exercises that I will talk about at the end of this video will also be applicable to you guys and not just postnatal women who have abdominal separation. So this may still be of use to you guys as well. But yeah, so as I say, I've seen a lot of postnatal women who actually aren't even aware of this problem. To be fair, even when I was a midwife, all the focus is on breastfeeding and your pelvic floor, and no one ever really talks about abdominal separation. To the point that, there are women out there who, their kids are all grown up and, they're still having problems because they never even realised that it had happened, let alone, how to deal with it. So yeah, hopefully today I can give you a bit more information and just some ways, sort of do's and don'ts and ways to deal with it, exercises that you can do to try and just build that abdominal wall back up. So diastasis recti, what is it? Well, it's basically a partial or complete separation of the muscles on the abdominal wall. So the rectus abdominis, which are those, as I say, it's those muscles that give people a six-pack. And it's basically a separation at the midline of these muscles. And so what this does is it causes sometimes a visible gap in the muscles. Sometimes it's maybe not quite so visible, but certainly when I'll show you how you can sort of try and see if you have this, you may be able to feel a gap in the muscles when you do that test. So in terms of the abdominal separation, there are 4 types of diastasis, which I'm going to take you through now. So to start with, we have the normal state of the abdominal muscles, where these six-pack muscles here are basically, they come together, and where you've got the navel there, so the muscles meet on either side of that line. Okay, that's a normal, view of the abdominal muscles. Now, then we have what is the sort of most severe form of a diastasis, which is an open diastasis. So on here you can see the muscles have separated both above and below the navel, causing quite a long gap, and the gap on this is often wider as well. So this is the most sort of severe form of diastasis. We then have open below navel diastasis. So this is where the separation occurs just only below the navel, but the muscles above the navel still come together. We then have above the navel. So here you can see the muscles still pretty much come together, you know, below, but above the navel we see that separation there. Okay, now, and then the fourth one, so we had our open diastasis, okay, here, which is above and below, and then we have a completely open diastasis where it's not only, if we look back, see it kind of is wide open above and below, but in the open diastasis it kind of tends to pretty much almost come together at either end. But with the completely open diastasis, okay, it's actually a bit more of a sort of uniform separation, sort of from top to bottom. So those are the main types of separation. Now, the other thing is that what you'll find is, in addition to seeing maybe an obvious separation, is the stomach will protrude. And this is due to the reduced strength of the abdominal wall where it's separated, which in turn can cause or worsen lower back pain and also pelvic instability. Now, in terms of the stomach protrusion, there are different sort of shapes, if you like. Some people may still look like they've got a pretty flat stomach, but the gap is then quite often quite obvious. But a lot of people will have, so this is basically as if you're sitting and you're looking down at your stomach, you may find a cone shape, so where it just comes out and sort of basically sticks out mostly in the middle, at the midpoint. Okay, or you may find that you have a bread loaf shape where, again, it protrudes probably more widely than the cone shape, but kind of almost levels in the middle, a bit like a loaf of bread. And then we have the pregnant looking. And so this is where, you know, women will often say maybe months after having their baby, that they still look like they're pregnant. And some women, you know, even still get comments, oh, when's baby due? Which, you know, obviously nobody really wants when they're not actually pregnant. So those are the three main shapes of, you know, with regards to the stomach protrusion. So, apart from obviously the fact that women with this issue, you know, experience back pain and pelvic instability, why do we need to know about this? 66% of women with diastasis recti also have some level of pelvic floor dysfunction. So whether that's just a pelvic floor weakness or prolapse or continence issues, and I will be doing a video specifically about the pelvic floor, so keep an eye out for that one. You know, so it can cause additional problems, and, you know, problems that can really affect your, you know, just your daily life and self-esteem. Between 50 and 60% of cases occur during the second or third trimester of pregnancy, and this is due to the growing uterus, which stretches those abdominal muscles which then part at the linea alba, which runs across the navel. And so when this midline fascia, which is already going to be softened due to pregnancy, hormones, which obviously relax the tissues, when this midline fascia separates, not only does this reduced muscle support make vaginal delivery really quite problematic, but also if the muscle doesn't retract following delivery, it can lead, as we've said, to various complications. Now, 30% of pregnancies result in the muscles not being able to maintain their shape due to the amount of pressure. And in severe cases, a gap of around 2 centimetres in the muscle tissue can actually remain. So, it doesn't sound a lot, but actually 2 centimetres, it's quite a good gap. And as we've said, while predominantly being seen in pregnancy, this can also affect men, bodybuilding men, men who, overdo it on the abdominal exercises in the gym. They can also get separation of the muscles, and it can also affect newborn babies as well, particularly premature babies. So I will talk about that. So what are the main causes of diastasis recti? Well, it is more likely to occur in subsequent pregnancies, and especially if those pregnancies are close together as well, because the body's not had a chance to really properly recover. The muscles may still be quite weak anyway. And also if you've had a separation in a previous pregnancy, you're going to be much more likely for that to happen again, because there's already a weakness there. Very petite women, there will be a higher risk. And again, this could be potentially due to just there being more kind of pull on, if there's less muscle bulk, just there may be more pull on those muscles. So yeah, there seems to be a higher risk in smaller women. We've sort of mentioned about previous separation, but it also, any women who have, for whatever reason, just poor abdominal muscle tone may be, subject to abdominal separation. Because maybe there's just not that elasticity in the muscles to kind of accommodate, the extra growth quite as well. Women who are pregnant over the age of 35 will be at an increased risk. And again, this could just be maybe due to muscle tone not being quite as good. We don't know. Heavy babies, particularly large babies, or multiple pregnancies, which are obviously going to result in a much bigger bump because you've got 2 or 3 of them in there instead of just the one. These again are going to just put extra strain on those abdominal muscles because of the extra size and extra stretch. And that can be the case, obviously, again, if you've had a multiple pregnancy and then you have a single one, you're going to be more likely, with that subsequent single pregnancy to have the separation. If, for whatever reason you have excessive inner abdominal pressure, but certainly again due to the expanding uterus, that sort of inner abdominal pressure is going to be higher than normal. And, when you combine this with, the effect of the pregnancy hormones such as the relaxin, which and also the estrogen, which basically soften the muscles and ligaments to allow for this stretching, and not only during pregnancy but also during the childbirth itself. These are both going to kind of contribute to sort of a weakness there in the muscle. But also genetics can play a part, certainly, if your mother had separation, you may well be more prone to separation. And it's not just in terms of the pregnancy process itself. It can be due to actually something happening in the labour that causes a separation. So, for example, incorrect pushing technique during delivery, again, could put additional strain on the abdominal muscles, which can then lead to, to the separation. Incorrect even technique with exercises, before you're even pregnant. If you have incorrect technique when doing abdominal exercises, so things like sit-ups, or if you're lifting weights, again, this can cause a weakness in those muscles. As much as you think you're strengthening them, if you're not using the correct technique, it can actually cause a weakness, which can then be there before you even get pregnant. So then by the time you get pregnant and you have all these effects of the hormones and the extra weight and the altered posture, it's going to make the problem even worse. And certainly this issue around exercise and incorrect technique, and also yo-yo dieting. So if your weight's going up and down, and your muscles don't kind of have a chance to catch up with, sort of how they support your posture and everything else, that will have an effect both in men and women. So as I've said, this is an issue that can affect men in the gym. And so, sort of, weightlifting technique, for men as well is so important. Now, as we mentioned briefly, this can actually affect babies as well. Certainly, particularly premature newborn babies are sometimes born with diastasis recti, and this is basically due to a partially developed abdominal muscles, just due to them being early. But this does usually correct itself with time, and as they sort of go on to develop further. So it's not usually going to cause too many sort of long-term problems. Now, we did touch there on yo-yo dieting and how that can weaken the muscles. There has been some suggestion that your body mass index and weight gain during pregnancy may affect the risk of abdominal separation. Actually, to my knowledge, there's not been any research that proves that this is the case. It is only a suggested link, so I'm not really going to sort of go into that now. Now, so as I've said, in my practice, I've seen quite a few postnatal clients who come in with lower back pain, and then when I assess them, it becomes apparent that they've actually got abdominal diastasis, something that they haven't even heard of. But and obviously I'm happy to do that for my clients. but you know, your average massage therapist is not going to know how to assess for this, and they're not going to have the midwifery knowledge there, you know, to really be able to advise you very well. So a lot of massage therapists may well just, you know, if you go in and say you've got lower back pain, they'll just do a massage for back tension and they won't really pick up on it. So I'm going to tell you now how you can do a self-check for diastasis recti. Now, it is easier if someone else is doing it, but, you know, maybe you can even get your partner to do it or a friend or something. So basically what you need to do is you need to lie on your back, legs bent at the knee, feet flat on the floor. Just try to relax. Now, then what I need you to do is you need to raise your shoulders up off the floor just slightly. Okay, we're not doing like a full-blown sit-up here. It's just a little raise of the shoulders off the floor, supporting your head with one hand, or if someone else is going to check your abdominal muscles, you know, support your head with both hands. And then just look down at your stomach. Now, either if you're doing it yourself with your free hand or whoever it is that's going to be checking your muscles for you, just move the hand above and below the navel, along that midline, and see if you can fit. So if you've got your finger sort of vertically, see if you can fit your finger in a gap in that midline between the muscles. So if we were imagining a six-pack, in the middle of the six-pack, if you feel a gap of 1 to 2 fingers lengths, you likely have a moderate case of diastasis recti. And if you refer back to the sort of diagrams I showed at the beginning of this video, which show the 4 different types. So you've got the above navel, the below navel, the open diastasis, and a completely open diastasis. You can also find this diagram, and there is this post on diastasis is also can be found on my Instagram and also my Facebook pages, which I believe there are links down below too as well. So yeah, that's kind of how, but it's certainly easier if someone else does it for you. Okay, so now I'm going to talk, we've talked about causes. I'm going to talk about the symptoms of diastasis recti, and how, sort of aside from the assessment, how you can sort of recognise that this may be a problem. So obviously, the first thing that may be apparent is a bulge in your stomach. And again, at the beginning of this video, we talked about possible different shapes that you may notice, you know, obviously following having your baby. You may, you know, think, oh yeah, I'll get a nice flat stomach back. But, you know, you may have one of those 3 shapes. So it was the cone shape, the bread loaf shape, or the sort of pregnant looking shape. And this bulge may be more noticeable when you contract those abdominal muscles. But I'm going to show you some pictures now of abdominal diastasis, and maybe some of it might look familiar. So now, as you'll see, you know, there's quite a variety of sort of stomach protrusion that you may see. And it may, in fact, even be that you have quite a flat stomach, but just that the gap may be completely visible. So it may be obvious, you know, this is quite a sort of severe diastasis in this picture. Or it may be, you know, just you may feel it's more of a sort of just protruding and quite saggy sort of stomach muscles, as in here. But as you know, as you can see, there's certainly various shapes. You know, so in some of these more protruding stomach shapes, it may not be quite as noticeable, you know, it may not be immediately obvious that there is a separation there. Okay, it may even just look, you know, reasonably flat, but it may just look like loose muscle. Okay, you may not again see that obvious gap there. Okay. Or you may sort of get this kind of crease-like appearance where the surrounding tissue is very loose and sagging, where obviously it's been stretched, and then it may just form this kind of crease in the middle. So yeah, quite a few different appearances. So yeah, in terms of symptoms, obviously a protruding stomach or an obvious, as we've just seen in some of those pictures, you may see an obvious separation there. But there are other symptoms and other things that can happen as a result of the diastasis. So, you know, even if you can't obviously see that there's a separation there, you may kind of have some of these symptoms and then just, you know, kind of think, well, maybe I should kind of just get someone to sort of assess my stomach muscles and see. So as I say, most of my clients that I've had with this issue actually come in complaining of lower back pain, which of course when you've just had a baby, you know, can be a normal thing to have anyway, so you might not think that much of it. Poor posture, because obviously if you've got a weakness in your, you know, your abdominal, your core muscles, you know, there's going to be a weakness there, and you know, so your posture may well be affected. Constipation and bloating, you know, digestive issues may well happen. You know, even urine, leaking urine, because even the weakness in the abdominal muscles, you know, it can cause some pelvic instability. And if you've got any weakness of the muscles around the pelvis as well, you know, you may well get some sort of urinary incontinence. And I will be doing a video on pelvic floor weakness as well. And again, alongside the sort of poor posture, you're going to get things like restricted breathing and probably restricted movement as well, which of course will also be linked to any sort of maybe back pain that you might be experiencing. In very rare cases, and this is rare, it is also possible to have a hernia as well related to this separation, but that doesn't happen very often. So now in terms, there are symptoms certainly that you might notice, you know, once you've had the baby. But there are also actually some symptoms that you might notice in pregnancy that could indicate that there's a separation happening. So we're talking about the second and third trimester. You may notice maybe a little bit of a ridge developing on the abdomen, both above and below the navel. And this will be most noticeable when you're using those abdominal muscles either to stand or to sit up or to lie down. You may get, if you get severe abdominal back or pelvic pain, then absolutely you should speak to your doctor or certainly your midwife immediately, because this could indicate a separation that's already happened, and as we've mentioned, this can cause pelvic instability, and it can be quite problematic in terms of vaginal delivery. So it may mean that you are going to be at a higher risk of having an assisted delivery, that is forceps or ventouse. And then, of course, as we've said, postpartum, one of the biggest symptoms is having that bulge in the abdomen, still looking pregnant. That's quite a good indicator that there's some separation going on. So when you have this separation, we've mentioned a few of the complications, such as back pain, pelvic pain, damage to your posture, in extreme cases, hernia. There's also pelvic floor dysfunction, which, we've mentioned that you can have some issues with incontinence, and this is going to be due to pelvic floor weakness or dysfunction. Obviously, with the posture, you may have, and due to the pain, you may have, your trunk stability and mobility may be compromised. And as we've said, whether it happens in pregnancy or whether we're going to be talking about subsequent pregnancies, the separation due to the reduced muscle support, it can make a vaginal delivery more problematic. So it's definitely something to be aware of, and certainly if you are in that postpartum or postnatal period, and you are thinking that you're going to want to have more children, certainly, it's the time to get it sorted before you fall pregnant again, to really give yourself the best chance of having a good normal delivery in that subsequent pregnancy. So as I say, this is something that's not really discussed very often. A lot of people don't even know about that it even exists. So sort of finding advice and good advice on what you should and shouldn't be doing, can be quite difficult. Even when I was a midwife, it wasn't something that was talked about, and it's really sort of through my work as a massage therapist, really, and a sports therapist, actually, that I've really kind of come to know more about this. So, okay, do's and don'ts. So the don'ts: don't strain, because it will just make the problem worse. So when I talk about straining, whether it's heavy lifting, so including children, if you've already got a toddler as well and you're lifting them, it's going to put a strain on the connective tissue and the muscles that are already weakened, okay? And it's going to, increase the sort of pressure internally down onto the pelvis. But also in terms of if you have constipation, okay, straining to try and get a poo out is not going to help matters, because again, it's just going to put extra strain on those abdominal muscles and the connective tissue, okay, and make the problem worse. Don't hold your baby on one hip if it's painful. If you need to cough or sneeze, make sure that you support the abdominal muscles when you cough or sneeze, and you can do that with a cushion or just by holding them. A big one, and this is just, I get really, really frustrated with this one. So I'm really going to emphasize this point. I see so many Pilates and yoga instructors online that basically have no medical experience or qualification, have no real experience even sometimes in dealing with postnatal women, and they are basically, portraying Pilates and yoga as some kind of miracle cure. Granted, they absolutely have a lot of benefits, and I recommend them to my clients, regularly. But in this case, it's really giving false hope to women when they're telling you this is not normal. This is not just a normal result of pregnancy. Pilates, it will change your world and, get your core muscles, back to being strong. Well, yeah, in normal cases it would. But if you have any kind of pelvic floor weakness or abdominal separation, do not do Pilates or yoga exercises because it can make your problem worse. I cannot emphasize this enough, okay? Do not do abdominal crunches, sit-ups, push-ups, press-ups, front planks, jackknives, straight leg lifts. All these exercises make abdominal separation worse because they increase the pressure on those muscles, okay, and involve sustained contraction of those abdominal muscles, okay? So please, if maybe you have done Pilates or yoga through your pregnancy, okay, if they are telling you to do these exercises, okay, to bring your abdominal muscles back to normal, please just think twice, okay? And I'd be asking that instructor what qualifications and experience they have, either medically or with postnatal women, and specifically with dealing with problems such as abdominal diastasis and pelvic floor weakness, okay? Because in these situations, you need to be taking advice from people who are qualified to deal with this, and this has probably never been more important, that I say this. Without the correct support muscles, around your core, the sustained abdominal contraction involved in these exercises, it will just weaken the muscles further and make the diastasis worse, because what it can do is it can pull, where you've got that separation, it can pull those, it can pull outwards on those muscles, away from the midline, away from, that vertical sort of across the navel. So you have been warned. So basically this either increases the separation or it can actually even prevent it from coming back together. So you really need to be ensuring that you're doing the correct exercises for this particular issue, and that you are speaking to someone who is actually qualified and experienced in dealing with this issue. So, okay, so that's the don'ts. What do you do? Well, certainly when you're giving birth, do use correct pushing technique, and try, I know it's hard when you're in labour because you just want it out, but do try, the midwife will advise you, and do try to use correct technique, because using incorrect pushing technique, just the same as when you're doing abdominal exercises, can increase the pressure on sort of already weak abdominal tissue, and it can also increase downward pressure onto those pelvic muscles as well. Now, I've said about Pilates and yoga, don't get me wrong, I'm not saying Pilates and yoga are bad. Do try Pilates and yoga. Do try these type of exercises once the connective tissue is healed and once you've been able to get those muscles back together. You can then use the Pilates and the yoga type exercises to really strengthen the deep abdominal muscles. But again, make sure that you're with a trainer who is experienced in diastasis recti. Okay, that is really important. Do try, you can find these, you can Google them. Do try, there's a couple of techniques out there. The Tupler technique, Tupler. And so this involves performing specific exercises while wearing basically a belly splint to protect and basically hold the abdominal muscles together while you're doing specific exercises. There's kind of mixed thoughts on this as to whether it works, but it's certainly something to look up and see for yourself. It may be something that you think, yeah, maybe that will work. So also do begin core strengthening, if you actually plan to get pregnant, or if you have suffered from abdominal separation and then are looking to get pregnant again. Do begin core strengthening exercises before you get pregnant. And again, so that can be things like Pilates or yoga, just to get those abdominal muscles nice and strong and flexible before you have all that added pressure of a growing uterus. If abdominal separation, certainly if it's small, you've got a better chance here. But if you have abdominal separation and you don't immediately seek treatment, do try to make sure that the muscles are brought back together before becoming pregnant again, because if you leave that separation open and then get pregnant before it's been fixed, you really are going to face problems. In that subsequent, you're going to have extra problems during the pregnancy itself and also during that subsequent labour. So it's really important that you get the correct help and advice, to try and sort of rectify the situation before it can then be made worse yet again. In terms of treatments, so if abdominal separation occurs during pregnancy, which may cause you back pain or pelvic pain, you can wear a splint or a kind of a tuba grip for extra support during the day. Certainly don't wear it all the time. I'd say avoid, any heavy lifting or straining, when you're on the toilet. And basically try to practice good posture. Supporting the lower back, when you're sitting with a cushion behind you, will just also help maintain your posture and support those abdominal muscles. When you're getting in and out of bed, or standing up off the floor, you might find it easier to do it by bending the knees, and kind of, rolling while supporting yourself with one arm. Just again, so you don't put added pressure on those abdominal muscles. You can continue to strengthen your core during pregnancy. but make sure that you are following modified and pregnancy safe exercises for diastasis recti. So again, you need to ensure that you've got a trainer who is experienced in dealing with this specific issue. If you are still experiencing issues 8 weeks postpartum, and the muscles haven't corrected themselves, because the smaller diastasis, it can correct itself, but if it hasn't corrected itself, pelvic floor exercises and the deep diastasis recti, specific exercises may help. Massage therapy may help in terms of improving the elasticity of the muscles, improving the strength and tone of the muscles, and certainly when combined with physiotherapy, can be really, really beneficial. Now, another thing that can help is kinesiology taping, which can help to support the abdominal muscles, to sort of activate correctly, and therefore improve posture and pain. What I will say is, I see so many people online who just kind of basically do it themselves and watch someone else do it online, and they think, oh yeah, well, I'll do that. Well, how do you know that person is qualified or doing it correctly or putting the tape in the right place? Again, just do see, a qualified professional who is experienced in dealing with this specific problem. Because at the end of the day, you don't want to make the problem worse. You can do the taping as well, actually, during pregnancy to prevent, if you're worried that a diastasis is happening, it can just help prevent it from worsening. But again, make sure that they are qualified and experienced in this. So we did briefly mention the Tupler technique. And also there's one called the Mutu system, MUTU. These focus on strengthening the core and strengthening those transverse abdominal muscles to ensure that your abdominal organs are well supported, and that there's less pressure on other connective tissue. These exercises are aimed at improving overall strength and stability rather than closing the gap. So these may be good things to do once you've been able to bring those muscles back together. Surgery, it is an option. If the pain restricts you from performing, normal daily activities, if there is a hernia, which, as we've said, is a rare thing, or for cosmetic reasons, if you've got a real kind of big bulge, and certainly for women who maybe didn't realise they had it, and then their kids have all grown up and, they're left with this big bulging, sagging stomach, then surgery may be an option for you. But certainly there are things you can do in the way of exercises that can actually, solve the problem. So it will more than likely involve a combination of treatments. Massage and physiotherapy, or massage and exercise, they work very well together. And doing these, it's not like a one-off thing and then you're cured. It involves regular treatments, usually I'd say over a period of 8 to 12 weeks, but obviously it does depend on how bad the separation is. And again, I will emphasise, ensure that it's with professionals who are qualified and experienced in dealing with this condition. And, while treatment can be started after, many years after having the baby, Obviously the chances of success are likely to be higher, with earlier interventions. So, but I would suggest, a suggested plan of treatment could be maybe 4 to 7 sessions with a massage therapist such as myself, maybe 3 to 5 sessions with a physiotherapist who specialises again in working with diastasis recti, and probably 15 minutes or so of exercises that you do yourself at home every day. So you need a little bit of commitment here, but the outcome of bringing those muscles back together will just positively affect your health and your life and your ability to do daily activities in so many ways that it's going to be worth it. Okay, so I now want to go on to talk about exactly how massage can help with diastasis recti. Certainly, I think I've sort of briefly mentioned that actually a combination of massage and physiotherapy or massage and exercise will be more successful than just using one of the treatments, and that's because they work in different ways. So massage will work by opening up tissues that are tight due to overfiring, and tissues that are getting overstimulated. So it opens up those tissues, releases any tension. It will also help to retrain the nervous system, so that the muscles can then relax. These muscles that are overfiring and being overstimulated. So if the nervous system is working more efficiently, then it won't be kind of overstimulating certain muscles, which can then cause tension and muscle tightness. Massage will also help to rebuild sort of good muscle tone in the abdominal muscles, and that certainly will work better if it's done alongside physiotherapy or exercises, for this specific issue. And massage also helps by increasing the visceral circulation, so circulation to those internal organs, which of course will make sort of all of the body systems function more effectively. Also, as we know, massage will work on releasing scar tissue. If you've got a lot of scar tissue, that's going to actually pull on the surrounding muscles. So, if you've got scar tissue surrounding, sort of maybe around the pelvic area, or in the abdominal area, that may well pull those weakened, separated muscles outward further, which would then, prevent sort of physiotherapy and prevent the exercises that I'm going to talk to you about in a minute. It will prevent those from working. So by helping to release that scar tissue, massage, can then sort of help increase the effectiveness of the exercises for the abdominal separation. Physiotherapy, on the other hand, works on strengthening and tightening muscles that are weak due to underfiring. So the muscles that are not getting stimulated by the nervous system enough. Physiotherapy will work on those. So they kind of, physiotherapy and massage work sort of in sort of almost opposite ways in some respects. Okay, so I'm going to talk about some of the exercises that you can do for diastasis recti. These are very simple exercises. As I've said, sort of things like these Pilates-based exercises and exercises that you'd normally think of for abdominal muscles, such as sit-ups and planks, and these exercises that involve sustained contraction of those abdominal muscles. They're really going to do you more damage. So to start with, it needs to be just basic, gentle exercises to help bring those muscles back together before you start really, using real strengthening exercises, to get those muscles back in shape. So, firstly, before you do any exercises, you want to identify your core muscles, the deep core muscles. Without raising your chest or your shoulders or tilting the pelvis, you just need to gently draw your belly button back towards your spine, and as you slowly exhale, without raising the chest or shoulders, and those muscles where you draw the belly button back, those are your deep core muscles. So they're the muscles that we're sort of trying to, focus on. So the following exercises will help to both heal the diastasis and also to manage the symptoms as well. So first we have the tummy tuck. So this move basically is to stabilize your core, strengthen and tone your transverse muscles, but without that usual flexion that, as we've said, can stretch the midline further and worsen the abdominal separation. So you need to lie on your back with your knees bent, feet flat on the floor, breathing normally, and then you're going to just pull your tummy in below the belly button, drawing in the abdomen all the way towards your spine. Now this exercise should only involve the lower abdomen, and you're going to hold the move for about 10 to 30 seconds and then aim to repeat 10 times, 3 times a day. Now the next exercise is the pelvic squeeze, which is actually a simple Kegel exercise, and it involves tightening your pelvic floor muscles, and it helps to strengthen the core. So you lie down in a comfortable position, again on your back, with knees bent and feet flat on the floor, and breathing normally, just tighten the front and back pelvic floor muscles, as if you were trying to stop yourself from having a wee. And you hold the contraction for 10 seconds, and you repeat 20 times, 3 times a day. And once you've sort of perfected this, then you can aim sort of to do faster rounds where you squeeze for 1 second and then let go, and then obviously repeat. The next exercise is the pelvic tilt, which tightens the transverse muscles. And the aim of this exercise is to work your pelvic muscles, not your glutes. So again, you lie on your back with your knees bent, feet flat on the floor. Place your hands, palms down, on your lower abdomen and contract your lower abdomen muscles. Breathe normally while rolling the pelvis up until your lower back is flat against the floor. Keeping the shoulders relaxed. You're then going to hold the position for 10 seconds and then relax the pelvis back down. And repeat this 5 times. So then we have our upright plank with support. So as we've said, the traditional plank pose is great for strengthening the core, but should be avoided if you have diastasis recti, because it puts pressure on the abdominal separation. But you can modify the plank pose and practice it in the standing position with a wall for support. So, stand straight facing a wall and rest your palms flat on the wall in front of you, keeping your arms and shoulders straight. Draw your belly button close to your spine to engage your core while breathing normally. Do 10 repetitions, and if you can hold it for 10 seconds and still feel strong in your core, then you can give it a bit of a boost by adding a few small wall push-ups. Okay, then we have the upward plank. So you lie in the supine position, so on your back. Keep your legs hip width apart with your feet flat on the ground, toes pointing straight forward. Support your shoulders by placing your hands beneath, and then slowly move your heels towards your buttocks so that your fingers can touch the heels. While breathing in, lift the hips up off the floor, and while breathing out, press your hands into your shoulders and spread out your collarbones. Now, breathe out slowly, hold the pose for at least 5 breaths, and you can gradually increase that up to 20 breaths. Now this last one is going to sound really basic, but actually it's something a lot of people don't do, and that is deep belly breathing. So by practicing deep belly breathing correctly, you can actually tone up your abdominal muscles, as well as regulate the heart rate, reduce your blood pressure, and lower your stress levels. So you just need to sit down cross-legged on the floor, or you can do it lying on your back. Inhale deeply until you can feel the fullness in your belly and chest. And then exhale gradually, tightening your abdominal wall, and repeat 10 times, 3 times a day. Now, okay, so they're the exercises. We have talked in this video about the Tupler technique and the Mutu system, which haven't been proven with research to repair the diastasis, but you may want to look them up. And so they can involve using a special diastasis recti splint to basically bind the abdominal muscles while you're exercising. And this is actually an integral part of some exercise systems. But as I say, there's little evidence really to show that using a splint can strengthen the core or even close the gap in the muscles. But what it can do is it can support your lower back and just hold you in, making the bulge less obvious, and as I say, just support you while you're doing these exercises. But if you choose to wear a splint, make sure that you consult with a physiotherapist who can show you, how to sort of wear it correctly, and also can help you to find, the best fit. But as I say, this is not gonna, this is not gonna repair the diastasis. You need to be doing the exercise for that. So, so that's really it for this video. As I say, there are other videos that I'm putting up about pregnancy-related issues. I will be doing one on the pelvic floor as well, which will work alongside this video really quite well. So keep an eye out for that, subscribe, and you'll be notified when it comes online. Any questions, you can comment down below, or feel free to contact me through my Instagram or Facebook pages, and I will do my best to, find an answer for you. But yeah, for now, that's all from me. So yeah, good luck with the exercising, and do find a qualified and experienced therapist. But I will see you next time. Okay.